Good day everyone. My name is Catherine Ayrayos and I'm going to demonstrate urinary catheterization or inserting of the urinary catheter. So first of all, I would like to define what is urinary catheterization. So urinary catheterization is the introduction of the catheter through the urethra into the bladder in order to remove urine or to drain urine. So the purpose of this is to obtain urine specimen for urine culture. Next is to relieve urinary retention. Third is to ensure emptying of the bladder before delivery and surgery, preventing possible trauma. Next is to prevent bedwetting on incompetent patient. Next is to remove urine when it is not advisable or avoidable for the patient to void. Next is to determine whether the failure to void was due to urinary retention or urinary suppression. So next is to determine the residual urine, and lastly is to measure the hourly urine output. So there are three types of catheters. So first is indwelling, next is intermittent, and lastly is the external. So for this return demo, I'm going to using indwelling catheter. So now guys, I'm going to state the material. I will use sterile catheter, disposable gloves, sterile gloves, lubricant or KY jelly, antiseptic solution, cotton balls or gauze, pick up forceps, and if catheter is to be kept in place, or what we call dwelling, Foley, or retention catheter, we should include to the materials the 10 cc of syringe and distilled water, adhesive plaster, urinary bag, and scissor. So now let's proceed to the assessment. So in this part, we need to assess the patient by checking the identity of the patient and checking for the doctor's order. So good morning po. My name is Catherine and I am your student nurse for today. So before I start po to explain the procedure, may I know your name po and your birthday? This is to identify you po as my client and to also to evaluate po your consciousness. So okay po, thank you po Ma'am Sofia. So it was ordered by your physician na maglagay po ng urinary catheter sa inyo po. So, ang urinary catheter po is a tube, a plastic tube na nilalagay po sa urethra natin or sa ihian po natin sa urethra po natin to the bladder. So, diretso po siya sa bladder. So, ang purpose po nito is to drain the urine. So, ang ginagawa po ang urinary catheter sa madaming rason. Maaring ang rason po nito ay kailangan ng sterile urine specimen para sa urine culture. Pwede din pong para ma-relieve yung bladder niyo po dahil hindi makaihi. Pwede din po siyang ginagamit bago mag-surgery ang isang tao or ang isang patient para i-drain po yung urinary or yung bladder or yung urine ng isang patient. Ginagamit din po siya sa pag-measure ng output ng isang patient. So, in your case po, ang order po ni doctor is So, in your case po, ang order po ni doctor is you are going to have a catheter po dahil kailangan po ng urine specimen and kailangan din po nating masukat ang urine output niyo po. Naiintindihan niyo po ba? Okay po. So after the assessing stage comes the planning stage. So in this stage, we are going to prepare the materials, the patient, and the environment. So for the materials we need to prepare the materials beforehand. So the materials we are going to use in this procedure was stated earlier. So after preparing the materials, we are now going to prepare the environment for the patient. Preparing the environment will give the patient privacy to be comfortable during the procedure. We can give our patient privacy by closing the door and curtains and locking the door.
Kailangan sasaraduhan ko po yung pinto and yung cortina para walang makapasok dito sa kwarto. So, tayong dalawa lang po yun nandito. Okay lang po ba yun? Okay po. So, para po sa cooperation nyo is, kailangan ko lang po na sundin niyo po yung mga sasabihin ko, which is base po siya sa procedure, and aalalayan ko po kayo throughout the procedure. Okay po ba yun? Thank you po.
Is to provide a good lighting for the patient and for us to see the procedure. Next is to position our patient in a dorsal recumbent position and place the protective pad under the patient's buttocks. This is to protect the mattress or the bedding of the patient in case there will be a urine leakage. So now,
Position ko muna yung patient ko. So, ma'am, can you lay down comfortably po? You can lay down comfortably po and flex your two knees. Flex your two knees po. Tapos, i-wide po natin siya para ma-expose po yung perineal area mo. Now that my patient is in a dorsal recumbent position, I'm going to do a perineal care before inserting the urinary catheter. So, to do that, I'm going to practice a proper hand hygiene by washing my hands or by disinfecting my hands using the alcohol. So in my case, I already washed my hands, so now I'm just going to disinfect my hands using the alcohol. After disinfecting my hands, I'm going to wear a latex gloves. Do anything else is I'm going to put a protective pad under my patient's butt para masalo niya if may urine man na lumabas, ay may urine man na mag-spill sa procedure na to. So, ma'am, can you lift your butt po para malagyan natin ng protective pad? So, now that the protective pad is okay na, ang gagawin ko naman is i-drape ko yung patient ko. So, dahil mahirap i-drape yung patient ko ngayon kasi hindi naman siya totoong tao, let's say na lang na naka-drape siya. So, para mag-drape is kailangan ko magawa ng diagonal or kailangan naka-diagonal siya. Since mahirap nang gamitin yung drape ngayon, so kailangan lang, basta ang purpose ng drape is magbigay ng privacy sa patient at hindi ma-expose yung mga private part ng patient. Yung mga body parts ng patient na hindi naman kailangan na-examine. So now, I'm going to clean the perineal area of my patient. So, I'm going to do this with antiseptic solution in a cotton ball. With the antiseptic solution in a cotton ball, then I'm going to open the meatus of my patient using my non-dominant hand. So, o-open ko siya gamit yung index and thumb finger ko. So, I'm going to get some cotton balls with antiseptic solution to clean the perineal area of my patient. So, mag-ready din kayo ng kidney basin or na kahit ano na pwedeng i-dispose yung ating mga cotton balls. So, let's say na nakahawak na siya sa meatus ng aking patient is now I'm going to ngayon is ipupunas ko na siya isa, then discard, isa, discard, isa, discard, and isa, discard. So, now that my patient's perineal is okay and clean, I'm now going to change my gloves into a sterile one. I'm now going to prepare my sterile equipments or sterile materials. Para i-prepare yung mga sterile materials is I'm going to dispose So, I'm going to wear my gloves first. I'm going to wear my gloves or my going to put some lubricant dito sa aking medicine tray, and I'm going to put the kidney basin dito sa may ilalim ng or dito sa may direkta sa may labasan ng ihi ng patient. So, ngayon po is, ang gagawin ko is i-check ko yung urinary catheter or yung Foley catheter if gumagana ba siya or defect kung hindi siya defected. So, para hindi siya kung punta-punta kung saan-saan, is I'm going to wrap it around my hands, tapos insert 8 ml na saline water solution or sterile water sa dito para ma-check if kung naggagana ba yung balloon ng aking Foley catheter. So as you can see, gumagana naman siya. So dahan-dahan lang yung aking pag-plunge doon sa syringe para hindi pumutok yung catheter. So before inserting is I'm going to put some lubricant doon sa dulo ng aking urinary catheter. So now pwede na tayong magpasok sa ng patient. So pwede na natin ipasok yung catheter kay patient sa urethra ng patient. So para gawin yun is now I'm going to use my non-dominant hand so I can have a better visualization of my patient's meatus. Mag-insert na po ako ng urinary ng catheter. So sabihan niyo po ako kung masakit po para patulungan ko po agad kayo at mabigyan po agad natin ng lunas yung sakit. So breathe in po, breathe out po, breathe in po, breathe out po, breathe in po, breathe out po, breathe in po, breathe out po. So okay. So now po, now that may positive outflow na po or output na sa kidney basin. So para po ma-secure natin yung acting Foley catheter is I'm going to insert or I'm going to instill a 10 cc saline solution or sterile water. So make sure na walang bubbles dun sa ating syringe. And ngayon ipapabalo na natin yung Foley catheter. Papabalo na natin yung indwelling catheter. To check if secured na yung ating Foley catheter is we can check it naman sa pagtag ng onte. If hindi na siya matatanggal, ibig sabihin secured na yung ating Foley catheter. Now I can pwede ko nang i-connect dun sa ating urine bag. So pwede ko nang i-connect dun sa ating urine bag para ma-measure na natin yung urine outflow. So ito dapat is nakasabit to. Nakasabit to malapit sa bladder para dire-diretso yung dalo ng urine. So ngayon na secured na is I'm going to secure the urinary catheter sa legs ng patient ko para hindi siya magalaw. So now I'm going to remove my my sterile gloves and dispose it together with the urine. And I'm going to position my patient na sa kanyang normal position, and I'm going to drape her. Tatanggalin ko na yung mga protective pad. Now, for the male catheterization, we are just going to position our patient in a supine position rather than a dorsal recumbent position. Then, we need to repeat the whole procedure until we need to lubricate. So, for the male catheterization, we need to lubricate 6 to 9 inches of the catheter. After that is we are going to insert the catheter 5 to 6 inches until the urine begins to flow. And now, we are going to the evaluation or the documentation. After discarding your used materials in the appropriate receptacle is we are going to or we need to note the amount of character or the amount and character of urine before discarding it. After that is we are going to perform hand hygiene. After doing those procedures, we need to take the date, time, amount of urine withdrawn, character, and the patient's reaction. So now is I'm going to do the removal of the catheter. Now we are going to remove the retention catheter. So the equipment that we are going to use is kidney basin, syringe to deflate the balloon, cotton balls for drying the genital area, and disposable gloves. So just like the insertion of the catheter is we are going to assess for the patient's identity and for the doctor's order. After that is we're going to prepare the materials needed. So now is I'm going to wear my gloves. Or before I wear my gloves is I'm going to practice a proper hand hygiene, which is I'm going to wash my hands, and if ever I'm going to disinfect my hands. So let's presume that I have. So after I wash my hands, is I'm going to disinfect my hands with alcohol. Then yes. So now I'm going to wear my gloves. So the first step is after wearing your gloves, we need to clamp the urinary catheter so that it doesn't spill when we open it. So I'm going to clamp the urinary catheter. Para pagbukas ko is hindi siya dire-diretso. So I'm going to deflate the balloon before I So now I'm going to deflate the balloon using the syringe. So now that the balloon is deflated, I'm going to close my syringe. And now we should get a cotton with alcohol para tanggalin yung tape na pinang-secure natin sa urine catheter. So para lumambot yung tape is need nating lagyan siya ng alcohol para dire-diretso ang ating paghila. Ma'am, can you inhale po? I'm going to remove your catheter na po. Can you inhale and exhale po? Pag sinabi ko pong inhale is mag-exhale po kayo, mag-inhale po kayo. Pag sinabi ko pong exhale is mag-exhale po kayo. Okay po? So, inhale po ma'am. Inhale po ma'am. Exhale po ma'am. So after removing the catheters, I'm going to get a dry cotton balls and I'm going to clean or dry the perineal area of my patient. So for cleaning the perineal areas, I'm going to get a one cotton, then pahid, tapon, pahid, tapon, pahid, tapon. Then dry cotton to dry the perineal area. So I need to change my gloves now because it is already contaminated. So I'm going to dispose all the materials that should be before disposing the materials is I'm going to measure the urinary output of the patient. So we can see here if the measurement of the output. So in the appropriate receptacle is we are going to, or we need to note the amount of character or the amount and character of urine before discarding it. After that is we are going to perform hand hygiene. After doing those procedures, we need to take the date, time, amount of urine withdrawn, character, and the patient's reaction. So now is I'm going to do the removal of the catheter.